Good afternoon. It is my pleasure to join you virtually for this afternoon's Go Red for Women event. My name is Dr. Isiadinso, and I come to you from Emory University School of Medicine. I'm going to go ahead and share my screen. I am the Associate Professor of Medicine and a Medical Director for the Emory Center for Heart Disease Prevention. Today, I'm going to be speaking to you about heart disease in women. I'd first like to start by impressing upon you that heart disease is not just a man's disease. In fact, it is the leading cause of death for women. Among adult women, 44% have some form of cardiovascular disease. And in fact, there are some ethnic and racial disparities that you need to be aware of. There are higher rates of heart disease among Black women compared with whites, Hispanic, or Native American women. The statistics are quite alarming. Every year, about 800,000 heart attacks and strokes occur in the United States. About 1 in 5 heart attacks is silent, meaning by the time that the damage is done, the person has no awareness that they've had a heart attack. What are the risk factors for heart disease? Well, they include high cholesterol, specifically high levels of LDL, the bad cholesterol, and low levels of HDL, the good cholesterol. Tobacco use, diabetes, high blood pressure, or hypertension, as is known in the medical community, physical inactivity or obesity, and a family history of premature cardiovascular disease. So if you have a first-degree relative, which is a sibling, child, or a parent who had heart disease as a male before the age of 55 or a woman before the age of 65, that is a risk factor for you for heart disease. So it's important to know our family history. There are some unique risk factors for women, which I'll get into shortly. But I did want to share that some of those risk factors that I've just discussed occur at higher rates among women. Specifically, diabetes is present in 12 million women and is expected to double over the next 30 years. After the age of 65, more women will have hypertension compared to men. And 2 out of 3 adult women is considered overweight or obese. There are some risk factors that are unique to women specifically, and the first 2 occur during pregnancy. And so if a woman had diabetes during pregnancy, which is known as gestational diabetes, or they had hypertension during pregnancy, and the spectrum goes from either pregnancy-induced hypertension, or you may have heard the terms eclampsia or preeclampsia, that increases your risk for cardiovascular disease later on in life. Also, having diabetes during pregnancy increases your risk of later developing diabetes. And having had hypertension during pregnancy also increases your risk of having hypertension later in life. Women who have gone through menopause, who have lupus, rheumatoid arthritis, or psoriatic arthritis are also at risk for cardiovascular disease. So it's important to know what those risk factors are, so that if you do have them, or if you have a loved one who has these risk factors, they can talk with their physician or other medical provider about making sure that they're doing everything that they can to reduce that risk for heart disease. Well, what are the symptoms for heart disease? The most common symptom that occurs amongst women is chest pain. Not every woman will call it chest pain. Sometimes they may be experiencing chest tightness, chest heaviness, or chest discomfort. Now, while chest pain is the most common symptom of heart disease, women are more likely to have what we consider atypical symptoms of heart disease when they're presenting with a heart attack. And that includes weakness, fatigue, nausea or indigestion, pain along the jawline, neck, back, or shoulder blades. And finally, excessive sudden sweating. So what can you do now that you know what the risk factors for heart disease are and you know what the symptoms are? What can you do to reduce your risk of having a cardiac event? Well, the key here is living a healthy lifestyle. And that is achieved through exercise, adhering to a healthy diet, reducing your intake of high carbonated or high sugary drinks, and reducing your stress. So what does a heart healthy diet look like? Here I've included the diet recommended by the American Heart Association, which is the Mediterranean diet. That is a diet that is high in fruits, vegetables, grains, and legumes, and also includes low-fat or non-fat dairy products. Healthy sources of protein are those that are low in saturated fat. And so that means reducing your intake of red meat. Fish about twice a week, preferably the oily fish such as salmon or trout, is also recommended. Limiting our saturated fat intake to less than 7% of total calories per day, and limiting our cholesterol intake to less than 200 milligrams a day is also recommended, and limiting our sodium intake to less than 2.3 grams. Exercise is a fundamental part of a heart healthy lifestyle. The American Heart Association recommends striving for 150 minutes per week of moderate activity or 75 minutes per week of vigorous activity. It's important to recognize that you don't have to do all of this at once. So most people will break their 115 minutes into 30 minutes, 5 days a week. Others may do an hour, 3 days a week. The goal is as long as you do the exercise. So if you're somebody who follows a 30 minutes a day, the key thing is that you can do it all at once, or you can do 15 minutes in the morning and 15 minutes in the afternoon. You still get that same cardiovascular benefit. And it's important that women remember to engage in strength training activities. A lot of women tend to avoid this because they're afraid of bulking up, but that is not the case because we don't have the amount of testosterone that men do. Why should we exercise? Well, it has several benefits. In addition to reducing your risk of stroke and heart disease, it helps to improve your blood pressure. It actually will reduce your bad cholesterol and will raise that good cholesterol. So you're able to reverse some of those risk factors for cardiovascular disease. If you're a diabetic, exercise will actually help to improve your glucose levels. And there have been many patients whom I have followed and treated who have been able to come off their diabetes medications, or at least significantly reduce them through exercise, diet, and weight loss. Exercise is an incredible source of stress management. It definitely helps with treating depression and anxiety. And certainly in this COVID era, there's been a lot of stress. We definitely are aware of that. And finally, exercise helps to improve joint and bone health, reduces your risk of fractures and falls as we get older. It's important to know your numbers. So if you're a diabetic, your physician may be checking your hemoglobin A1C. And that tells them how well your glucose has been controlled over the prior 3 months. For people who don't have diabetes, you want your hemoglobin A1C level to be below 6.5, even below 5.9, because 5.9 to 6.4 is a pre-diabetes range. And for diabetics, your hemoglobin A1C should be less than 7. A normal blood pressure is 120/80. For those of us who may have hypertension or be in the pre-hypertensive range, so you don't have a diagnosis of hypertension, but you're above the normal range, our goal should really be less than 130/80 if you have hypertension. And for cholesterol, you want the HDL, which is a good cholesterol, to be higher. The higher, the better. So for women, the goal is to have an HDL above 50. And in LDL, you want that's the bad cholesterol, to be lower. So the lower, the better. Smoking is the most preventable cause for premature deaths in the United States. Cigars, chewing tobacco, and pipes aren't any better. And so whether you smoke tobacco, whether you chew tobacco, all of these will increase your risk for heart disease. There are many resources to help one quit if they do use tobacco. I've included here the toll-free number to the Georgia Tobacco Quit Line, which is 1-877-270-STOP. They provide free support and counseling to help one quit tobacco. They actually will also provide free supply for a period of time of nicotine patch or gums to help you quit. There are a number of medications that your physician can also provide to help you quit tobacco use and help you remain successful. This is my final slide and my take-home message, the American Heart Association's Life Simple 7. And this is really an overall summary of how to reduce your risk for cardiovascular disease and live a heart-healthy life. We talked about smoking already, getting active. Remember, 150 minutes of moderate activity per week or 75 minutes of vigorous activity, controlling your cholesterol and your blood pressure, eating a healthy diet, trying the Mediterranean diet as a start, but certainly making sure that you reduce your intake of fatty foods, red meat, high sugared meals, processed foods, maintaining adequate or normal weight, and controlling your blood sugar. So with that, I'd like to thank Representative Carter for having me participate in this session with you. She has a wonderful afternoon planned for you, and I thank you all, and I wish you the best of heart health.